Hi everyone, my name is Katherine Rehberg and I'm a physician assistant with Academic Alliance in Dermatology. I have the privilege of working in the Tarpon and Trinity locations, and today my lovely patient Nancy is going to be having a Fraxel laser done just around her mouth to help tighten and brighten the skin. So we're going to get started. We have already been numbing Miss Nancy for about 15 minutes. So this laser does require numbing prior to having it done. This laser is from Nordlys Candela, and it is called Fraxel. It's a non-ablative laser. So what that means is it does not break the skin. The skin remains intact. Okay, so Miss Nancy, are you ready? Okay. So she's already been numbed, like I said, and now we've also cleaned her off with HibaCleanse. Even though it's a non-ablative laser, we want to have a nice, clean skin before we do a procedure. All right, so laser is on, her eye protection is on, and here we go. Just a little laser. How does that feel, Nancy?
Not bad.
Not bad at all, huh?
Not at all.
So this laser is really nice. It is minimal downtime. So when you come out of the office, it's going to be a little red, kind of like a sunburn. The treatment itself, if you're treating the entire face, takes about 20 to 30 minutes. Have to do 2 to 3 passes. And of course, minimal discomfort. Not only are we treating fine lines, but we're also treating, well, we can treat stretch marks and acne scars and surgical scars. Typically taking at least 3 treatments to start to see significant improvement. But the appealing part to this laser is that you do have minimal downtime. So come out with the sunburn, a little red, a little hot. Really just need to moisturize and wear sunscreen. Healing time, typically a week to 2 weeks. But again, after about 24 to 48 hours, that redness has diminished significantly. You still doing okay, Miss Nancy?
Yeah, I'm fine.
So as this laser fires, it also has a cooling air system, so it cools the skin as we go, so that way it's a little bit more comfortable too. The goal of this treatment is to rebuild collagen. So that's what we're doing with the laser device. And there's lots of different ways to rebuild collagen, as you've already seen. We have skincare, we have different types of lasers, there's microneedling, there's PRP. So you're gonna find the right fit for you with our practice.
So one question we were sent in by a viewer is this treatment painful?
So I've had it done, and on a scale of 1 to 10, 10 being, of course, the most painful, I would give it about a 3. Nancy, what would you say?
Yeah, I think about the same.
Out of 3?
Luckily the numbing, you know.
Yeah. The numbing really, really helps.
Feels like a sunburn.
Little sunburn, exactly. Yeah. This is suitable for most skin types. If you do have a darker complexion, we're going to need to look at some other options. But we have those here.
The next question is there any downtime?
So you're going to be red after treatment. That redness typically lasts a day to 3 days. But not too long.
The next question is, how does this compare to other lasers like Halo?
So it's just a little bit of a different technology, okay? Halo is going to give you a little bit more downtime. Ultimately the same end goal though. Halo is available in our South Tampa office, and our Fraxel laser is available in Trinity and in Sarasota. Is that right, Lucy? Naples. Even
Another
further
viewer asked, do I have to stay out of the sun for the first 3 days after my treatment?
I would recommend that you do, yes. And wear sun protection. How are you feeling?
Not bad.
Not too bad, huh?
Yeah.
Easy. And if you can get on a close-up, you're just going to see that she's just a little red. And so we would apply something like Elastin Nectar and some sunscreen, and you would be good to go. You'd start to see results in about 2 weeks. And you'd have my number, and if you have any questions, you can just give me a call.
That's right.